Salt is often called the heart of every dish. But for patients with hypertension, it's also the heart of many concerns. How much is too much? We all need to know. Let's turn to an expert for clarity regarding ideal salt intake for managing hypertension.
That's very important question, Ronit. According to JNC 7 recommendation, reducing salt intake is one of the simplest yet most powerful way to control blood pressure and prevent heart disease. Ideally, sodium intake should not exceed 2.4 gram, which equals about 6 gram of salt, 1 teaspoon a day. This small change can lower systolic blood pressure by 2 to 8 mm of Hg. But it's not just about cutting salt. Maintaining enough potassium, calcium and magnesium in your diet is equally important because these minerals help balance the effect of sodium and support healthy blood pressure. So combining less salt with balanced diet rich in fruits, vegetables and dairy can make a significant difference in managing hypertension.
Thank you, doctor. Your expert advice will empower patients to strike the right balance, savor their meals and successfully get to goal for healthier blood pressure. One of my relatives has high blood pressure but tracks it diligently twice a day, keeping a record to stay in control. While some friends tease him, it raises the key question: how crucial is regular BP monitoring and what's the best way to do it at home? Doctor, please, could you share your expert insights?
Absolutely, Ronit. Monitoring a blood pressure at home is one of the smartest habits a hypertensive patient can adopt. It helps detect early changes, ensures that your medication is working properly, and reduces risk of serious complications like stroke and heart attack. Ideally, blood pressure should be checked twice a day, once in the morning and once in the evening, in calm and relaxed environment, and keep simple logbook or digital record and share it with your doctor during visit. Because consistency is the key. When you know your number, you can manage them better. That's you can protect your heart for the long run.
Thank you, doctor, for clarifying this important topic. Your guidance inspires patients to take control and confidently get to goal with their blood pressure targets. Exercise is often called the best medicine. But is it the same for hypertensive patients too? If yes, which type of exercises are recommended and which are to be avoided? It's so confusing. Let's ask our experts for insights on the role of exercise in managing high blood pressure and whether there are specific types or durations of exercise recommended for better control.
That's a great question, Ronit. And yes, exercise is absolutely the best medicine even for those patients with hypertension. It helps lower blood pressure, improve heart health and enhance overall fitness. According to physical activity guidelines from US Department of Health and Human Services, adults should aim for 150 to 300 minutes of moderate intensity aerobic activity per week, like brisk walking, cycling or swimming. Alternatively, 75 to 150 minutes of vigorous activity like running or aerobics can also work. On the top of that, muscle strengthening exercise at least 2 days a week are also recommended. However, people with uncontrolled blood pressure or severe hypertension should avoid weightlifting or any exercise that causes sudden spike in blood pressure and always get a medical clearance before starting. The secret is moderate, regular and enjoyable activity. Something sustainable that keeps both heart and blood pressure in balance.
Thank you, doctor, for highlighting the critical role of exercise in managing hypertension. Your advice will help patients incorporate the right physical activities into their routines and stay on track to get to goal with their blood pressure targets.